everyone know. And we will send out replays and give everyone access to the replays for a week as well. So let's get started. I know it's Sunday. I know it's supposed to be the beginning of the week, but we really kind of feel like the end of the week, like, ooh, am I ready to brace this next week, right? But we are always graced for our next. So my name is Sierra Keaton, and I am known as the Canna nurse. I'm a cannabis nurse, educator, coach, and consultant, amongst a bunch of other stuff. But I am founder of Keaton Consulting, and it is a cannabis educational firm where we educate the communities, healthcare professionals, and corporations about alternative wellness solutions, but specializing in medicinal cannabis, of course. I am also founder of Balance Relief, and we are a CBD and wellness cannabinoid company. We specialize in making customized CBD products to help the communities with their different elements. And last but definitely not least, which is a new venture for me, I am owner of Relief Wellness Spa, and we are a medical spa located here in the Atlanta area, and we are geared toward combining medical therapies with the cannabis world. So that is a little bit about myself. The Canna Summer Wellness Summit, this is our second annual one. This summit started last year as we had gathered a cohort of cannabis nurses and was able to pinpoint that we all are on the same mission, but we all have a different end goal and end focus, and realizing that we had all of these specialties and all of these things that needed to be delivered to our communities. And so we came together to be able to present this information to the communities. Last year was phenomenal. We talked about mental health. We talked about women's health. We talked about weight loss. We talked about taking your power back with cannabis. It was just an amazing time. And I knew that I didn't know that it would continue to develop into what it is, but definitely something that we're not going to stop anytime soon. Our mission here is to make sure that the communities have access to the education, products, and everything that they need to know that there is a way that they can live well, the holistic way, and just bringing light to removing the stigma that fortunately is so heavily posed on cannabis, marijuana, however you want to use it. This year, our theme is tackling disparities in the cannabis communities of color. So why this topic? If you follow any of cannabis, medical marijuana laws, things like that, social equity is huge inside of the cannabis community. People of color don't have access to even begin to have access to the plant, have access to the businesses. They are the ones that are affected the most by the laws and the regulations behind cannabis. And that is a big focus this year inside of the cannabis world. So with us being nurses and being in the healthcare profession, we see a little bit slightly different angle than I want to say the cannabis community. And we already know that people of color already have a whole multiple layers when it comes to access and disparities in healthcare. So if you think about my poor client who is a person of color and who may be a client who's needing medicinal marijuana, think about what their access is to that, right? And so we wanted to bring light to how the communities of color are affected when it comes to disparities in healthcare inside of the cannabis community. So we are going to spend this whole week serving the community in regards to these different topics. So tonight we are opening up with Dr. Veronica Barnes, and I'll introduce her in a moment. She's going to be talking about how to remove the stigma of having the cannabis talk. And I wanted to start the week off strong with that because that is, number one, probably one of the biggest questions that we get, right? Well, how do I ask my doctor? If I ask, are they going to label me? There's all these questions when it comes to people don't even want to begin to have the conversation. So, if you don't ask, you don't get. No ask, no tell. And so we want to start the week strong with that. We do have a week-long full of impactful webinars. So we hope that you can join us. On Monday night, we will be having the lovely Dr. Latora Grant Scott. She is a PhD educated nurse who specializes in the science behind cannabis and the endocannabinoid system. And she's going to be talking about stress relief and how as communities of color, ways that we need to control our stress and how that works with cannabis. We're also going to have Dr. Cynthia Garrett, who's going to be talking about lupus and her journey with cannabis. And particularly her focus is going to be on how she has used cannabis to heal the skin issues that she deals with lupus. So that's on Monday night. Tuesday night, we're going to be talking about the opiate crisis. We have two wonderful nurses who are coming from two different angles when it comes to the opiate crisis and how cannabis and medicinal marijuana play a role in that. The first presentation will be talking about sickle cell disease and really giving a history. So we're not just going to be talking about cannabis all week, even though we could. We're going to be talking about the issues behind the disease processes. We're going to be talking about the science behind it because it's the lack of education that takes your power away. And we're going to keep our education simple. We're going to make sure you can understand it, but know that there is a science behind cannabis that they don't put on the forefront. And we want to make sure that you understand how it works with your body and why it works so well. Right. The second presentation will be by Adrienne Smith, and she's going to be talking about her journey as a lupus warrior and how she used cannabis to regulate her journey the holistic way. On Wednesday night, we're going to be tackling pain management from a different perspective. We have the lovely Rosalind Jordan, who is a practitioner. We talk about cannabis, pain management, and just really her journey as being in family medicine and having to deal and manage those patients. Hold on, sorry, I got people trying to come into the room. Thursday night is Women's Night, and Women's Health Night is always so surprising inside of cannabis because people don't really correlate the two. And so we want to bring light. We have two powerful webinars on Thursday night. The first one is going to be Christine Walker, going to be talking about postpartum depression and cannabis and how to regain your joy. And then we have Vontrice Warren, who is a women's health nurse practitioner, who's going to be talking about the issues that women of color have inside of women's health, and also bring a wealth of information about how cannabis and cannabinoids help in dealing with our women's health. And she's going to be digging deep. Her passion, I think she introduced herself on here as women's health nurse practitioner. She walks, talks, and breathes. So that's going to be an amazing night. And last but not least, on Friday night, we're going to be talking about two taboo issues, and it's our grand finale. We're going to have Miss Willa Smiley. She's going to be coming in and talking about nurse practitioners that are ghosted. Particularly, she is from New York, so her experience is going to come from that angle, but how nurse practitioners are left and expected to be able to properly care for these clients who need medicinal marijuana or who may even be seeing them and don't have access to the education. And what are they to do? right? They're left stuck with their license on their line. They're left stuck with patients not having proper education and backup. So that is the first topic on Friday night. And last but not least, I will be closing out the summit on Friday night. We're going to be digging deep and talking about advocacy in the communities of color. We're going to be talking about how we need to relearn our cannabis use and how we learn how to use cannabis for our wellness and not just recreational. And we're going to talk about the mindset behind that. So I'm definitely super, super excited to be here all week long to help people gain clarity, get some education, and this community build here with you all. If you are just joining us, welcome. If you have any questions at any time throughout the presentation, please drop them in the chat. A lot of questions sometimes get answered as they go along. So if your questions are not answered as they go along, we make sure to get to them at the end, and we will. Someone has to mute their speaker. Okay, I'll make sure the room's muted. And last but not least, we will have an open Q&A session toward the end. All righty, so a little background. The word disparities, right, is such a huge word, and there is so much that can be broken down with that. When we talk about disparities in healthcare in general, there are 5 or 6 that are the most common ones, right? Some disparities in healthcare related to life expectancy, the burden of a certain process. It could be mental health. Welcome. Uninsured versus underinsured, right? And last, but definitely probably the one that most people think about is lack of access to care. Okay. But tonight, we're not just dealing with disparities in healthcare, we're dealing with racial or ethnic differences in the quality of care that people receive, right? So again, we have all these layers when it comes to the communities of color and access to the information that they need, because I always tell everyone, it empowers you as a patient. And when you are properly educated, it really, it sets the bar, not just for your life, but your the healthcare that you receive is really geared toward how educated you are about a particular topic, how in tune you are with that. So the more that we educate our communities, the more we empower them, that is when we will begin to see our communities get healthier. When we begin to talk about wellness and disease prevention instead of treating the disease process, we will begin to see some of these change. So a definition for you, because I like it sets the bar. I always have my own interpretations of a lot of things, but the Institute of Medicine defines disparities as racial or ethnic differences in the quality of care that are not due to access-related factors or clinical needs. Right, so this sets it apart. This has nothing to do with access. This is all geared toward those racial or ethnic differences. And it was found that racial and ethnic minorities tend to receive poorer quality care compared with non-minorities, even when the access-related factors such as insurance and income are controlled. That's huge. So let me say that again. Sorry, I'm gonna mute someone. Racial and ethnic minorities tend to receive poor quality of care compared to non-minorities, even when factors such as insurance status and income are controlled. Okay, so that lets us know that we have additional layers that we have to fight through and control to be able to get the proper care that we need. Unfortunately, it's going to take a little bit more than non-minorities in this current healthcare system. Okay. Some of the other things that play into this racial disparities is the sources of racial and ethnic healthcare disparities include differences in the geography, lack of access to adequate health coverage. So they may have healthcare, but they may not have access. I used to work as a transplant coordinator, and there were many patients that needed transplants but couldn't get one due to their insurance, or they couldn't get the testing done, or they couldn't get there were so many parts of that they just didn't have access to. They didn't have access to a life-saving modality. Okay. In addition, our healthcare system overall shows that there's a big difference in health status that affects racial and ethnic minorities. So it is definitely a mission to correct these disparities. Okay, now that we're just talking about healthcare, I want to give you just a snippet when it comes to the medical marijuana industry. Okay. Welcome. Okay, so let me make this very, very, very clear. Medical marijuana use is most common among individuals who are employed, have health insurance, and earn high incomes. Okay. Majority of medical marijuana patients are white. Okay. Particularly, there was a study, because I always give a reference to what I'm talking about. In New York, medical cannabis services are least available in neighborhoods with Black residents and most available in urban neighborhoods with highly educated residents. Benefits of the legal cannabis must be shared by communities that are disproportionately harmed by illegal cannabis. The communities that need it the most have access to the legal side of it the least. Right. And so this is why having all of these layers, this is why we are here this week to talk about what our communities face, how we can help to get over that. How can we empower our communities, our families, our children, right? And I'll give this little snippet and we'll get right to Dr. Veronica Barnes. Just on my social media platform yesterday, there was a nurse practitioner that had posed a question. And even though she posed a question for open conversation, it was kind of controversial because she stated, why would a mom dare ask for medical marijuana for a child? And I began to read some of the comments. And basically, the provider had made assumptions. She said the mom always comes in, her eyes are dilated. She just does, it just seems iffy. She couldn't understand. She couldn't even see past the layer to even know that there's education behind why someone would want medicinal marijuana. The situation was stereotyped before anyone ever took a look at it. And that's the issue our clients face. They are stereotyped before they even get to open their mouths and say anything. So if someone were to have that happen to them and they came back and told their community, do you think others would be on board to go out and ask their healthcare provider? No. So it is important, especially us as nurses, we're that bridge, we're that gap to make sure that you and our communities and these providers are properly educated and that our patients have a voice and that they have someone that's advocating for them on their behalf to take control of their own health. And I will end with that because I could talk about cannabis and my community and advocacy all night long. I want to introduce the highlight speaker for tonight. So tonight presenting presentation will be given by the lovely Veronica Barnes. Excuse me, let me switch my screens here. My apologies. All righty. So a little snippet about Dr. Veronica Barnes. She is an advanced practice nurse in the state of Virginia. She did receive her undergrad degree from Hampton University. Whoop, whoop. I have a fellow family member that's a graduate. She also got her nurse practitioner degree from Southern University and psychiatric mental health and doctorate from Shenandoah University. So Dr. Veronica Barnes provides behavioral health services that include anxiety, depression, bipolar, ADHD, and supportive therapy, just to name a few of the things that she scratches the surface on. Right. She uses her knowledge as a family and psychiatric mental health nurse practitioner to implement holistic care for her patients and maintaining the stability and well-being for them. She has worked at the Hampton VA Medical Center for 9 years and implements care for veterans in the community. She also has concierge behavioral health services with patients in mind, providing services directly to the patient via telehealth or home office visits. And tonight, Dr. Veronica Barnes is going to be talking about destigmatizing the shame of the talk, advocating for patients related to medical marijuana when talking with their healthcare providers. So I want to bring to the screen, sorry, I think there might be a lag, so I apologize. Want to bring to the screen Dr. Veronica Barnes and hand her her flowers. So you guys give some kudos, some energy as she comes and shares her knowledge with us.
Welcome, welcome, welcome. Okay, so hold on, let me share my screen. Let's see. All right, can y'all see my screen? You can see? All right.
Yes.
Yes.
All right, awesome. Okay, so again, I am Dr. Veronica Charity Barnes. I am a family nurse practitioner, psychiatric mental health nurse practitioner, and cannabis nurse. So some of the topics that we'll be discussing today will be, again, destigmatizing the talk when talking with your medical provider against alternative medicine to help with pain and many other ailments. Stigma, there's a lot of stigma related to it. History of cannabis and laws in Virginia, since that's where I'm based. Okay. In reference to how I practice as a provider, I would like to think I'm an open and receptive provider. I practice with a heart of gratitude and service. With that in mind, I'm aware that patients can choose any provider. They can choose to go to anyone they want to. What I would say when looking for a provider, you should seek someone who's an active listener, who encourages their patients to be active in their treatment plan, not be embodied. These are all traits that I follow. I'm very transparent with my patients. We kind of talk as friends, and they can be very open with me. Even if it's something I don't know much about, even when it came to cannabis, when cannabis came about and in Virginia and everyone started asking about it, I wasn't that knowledgeable about it. But with my transparency, I would say, you know what, hey, if I don't know something, I know how to read. One thing I know how to do is to research, and I know how to consult another provider. What started me on the cannabis journey, again, was the influx of patients, mental health patients, primary care patients. They're asking, hey, I want to try something new. I'm on a lot of medications. I'm tired of being on these medications. And with that, I realized, hey, either you keep up or you're left behind. So at that point, I reached out, I started doing research, found a cannabis program, and here we are today. I would like to say, because of the way that I practice, that has allowed me to have great relationships with my patients. They share, they pretty much share a lot with me, sometimes a little bit too much, but that works in my favor. So objectives that you'll have at the end of this will be, what are some perceived stigmas related to medicinal cannabis? Also, you'll hear it called medical cannabis. The importance of speaking with your medical provider about medicinal cannabis. options with CBD for those who can't have THC in their system, because I have a lot of patients that just can't have THC. What to do if your provider isn't on board. So, some background. The Controlled Substance Act of 1970 made cannabis a Schedule I drug. That places the drug along opioids, methamphetamines, and other substances that are considered to have a high potential for abuse. And per the FDA, that means that it has no medical use in the United States. We all know that cannabis used to be prescribed as a medication, but eventually that went away. Because of cannabis being aligned with a controlled substance and as a Schedule I, that makes access to research very hard. It's because it's highly restricted most of the time. According to federal law, no prescriptions may be written for a Schedule I medication. Again, cannabis is a Schedule I medication. So in a state where it is legal, what we as providers present is a certification. Again, because cannabis is a Schedule I medication, it is associated with heroin, LSD, ecstasy, and bath salts, among some others. So Sierra kind of briefly spoke about what is a stigma. Again, there's many definitions of it, but a social stigma is defined as the disapproval of or discrimination against a person based on the perceived social characteristics that serve to distinguish them from other members of society. So another way to help eliminate that is for cannabis to be viewed as a medication and not a street drug. So what are some perceived stigmas when someone thinks of someone using cannabis or smoking weed? Is it their physical appearance? Is it someone that has piercings, someone that has tattoos? Is the person a drug addict? Is the person uneducated? A lot of these things are reported by patients who are just like, hey, whenever I even feel like I want to discuss it or I want to talk to my provider about it, there's this stigma. It's like I'm a bad person. Misconceptions and biases don't help anyone. So a part of eliminating the stigma, I have a story just to tell in reference to, I was in an intake with a patient who came in all the time. It was a patient that had severe chronic pain. And if you know anything about anyone who has chronic pain, they not only have chronic pain, then they have anxiety, they have depression. The patient had PTSD related to the accident that precipitated the chronic pain. And he knew that Virginia was coming up on having medicinal cannabis available. So he simply said to the provider, he was like, hey, you know, how can I get it? What can I do so I can get off these pain medications that I'm on? So the provider, and he had asked multiple times, and the provider again said, I don't believe in it. Again, no looking at research, no trying to increase their further knowledge and understanding that, hey, maybe if your state is allowing medicinal cannabis, maybe it is treated as a medication, despite how he felt personally. So again, this patient is one who was on Schedule II medications, a medication that he had to ask to be refilled every 30 days. So therefore, he would get anxiety just thinking about having to ask his provider, hey, I need my refill on, say, a Percocet that's even barely touching the pain that he was having. So again, that was a stigma and a bias by the provider not wanting to go further for their patient, not wanting to see what else is out there. Things change. It's time to move forward. So not only that, that client of patients not only receive Schedule II medications and their refill, well, a new prescription is written monthly, but they're also, some of them receive Marinol. And if anyone knows anything about Marinol, it is a man-made form of the active natural substance in cannabis. Marinol has been federally legal since 1985. So in reference to doing research and going the extra mile for your patient, as a nurse, I work off of evidence-based practice. And we have guidelines, just like a medical doctor has guidelines, nurses have guidelines, and we have guidelines on where to go to in order for us how to practice. So for nurses, we go to the National Council of State Board of Nursing. And in here, even though it's not an abundance of research that we would like in reference to cannabis, we do have guidelines and we do have things that we can follow. And with that, so in here, it had a list of specific ailments. And one of them, I just chose Tourette syndrome. I have Tourette syndrome. I've had it since I was a little girl. So with Tourette syndrome, it says that tic disorder can be treated with THC, 5 milligrams, 7.5 milligrams, or 10 milligrams. And the result of being treated with THC is improvement in tics. And again, that's involuntary movement of the body, or obsessive compulsive disorder. Again, if the provider that was asked, how can I get off of these opioids? If maybe just went the extra mile, went to his evidence-based practice, then maybe that could have helped out the patient a little bit better. And other patients, not just that patient. So additional ways to eliminate the stigma are to share your experiences. Many people have smoked cannabis and can share how it helped them. Sharing that with your provider may open up the doors. A couple of weeks ago, I received a phone call because in the state of Virginia, if you're a provider and you fill out certifications, people can just go on the list and they just pick somebody. So I received the call from a patient and he said, hey, I was trying to get a certification. We went through the whole assessment, everything that I do. And part of the assessment is asking, how did he hear about me? And what made him go this route? So pretty much another patient that is in chronic pain. And what he said is that his provider, primary care provider, actually recommended that he get a cannabis card. So again, there are providers out there that are willing and understanding that the world is changing and that cannabis is actually a medication. And I was able to help that person. Benefits include reducing pain, reducing anxiety, inflammatory benefits, antimicrobial, bacterial and fungus, and anti-tumor properties. So again, there's so many things, and this is not conclusive of everything that cannabis treats, but a huge anti-tumor property comes from, there's a Rick Simpson oil, not too many talk about it. It is a high THC rich cannabis extract oil with the minimum of 55% THC that is then digested at a steady rate over a period of time. What happens with that is it precipitates metabolic pressure on cancer cells. The high THC cannabis oil triggers cancer cell deaths. So again, because of cannabis being a Schedule I, it's hard to really do studies on it. But there are studies. There's walking, breathing studies for people that were test that when they followed the Rick Simpson protocol, their cancer was healed. I really want to talk about that. So I have a person, a lovely lady up here for a personal testimony. Hold on, let me see. Lynn, if you're up here. Hold on, I think I saw you earlier.
Yes, ma'am.
Okay. So I will let her introduce herself, whether she wants to give her full name, disclosure, and all that, but she is here and she will give her testimony of how I am as a provider with her, how our relationship as provider and patient is, and her journey with medicinal cannabis. She was one of the first patients that I actually provided a medical card to. So here you go.
Hello, my name is Lynn Nguyen, and I'm here to talk about my journey with Dr. Veronica Barnes and medical cannabis. Like many, I wasn't sure how my providers viewed cannabis, especially as a medical option for mental health. On top of that, my first few experiences with cannabis was given without my knowledge and led to severe reactions due to my lack of exposure at the time. So I was very reluctant about trying it out for myself, despite evidence showing how it can be beneficial for mental health. In looking for a provider, I wanted to find someone who was straightforward and open-minded. From the very first meeting, I knew Dr. Barnes and I would get along. She wanted to know what I was looking for and what I've already tried to do for my mental health. This showed me that she wasn't a cookie cutter provider and understood that different methods worked differently for different people. I'll be the first to admit that I can come off rather intense going into medical appointments because of my background in the field. I came in with a folder that contained lists of my undiagnosed issues, symptomatic concerns, potential concerns, and that I wanted to keep track of, and general medical history, all of which had monthly trackers. I started doing this because I noticed how often a provider would selectively hear terms and make assumptions about me based on my appearance and age. So if they hear me say depression, they're gonna be like, oh, like this is what she is, let me just throw medication at her and not really like listen to everything that kind of goes behind it. But Dr. Barnes never batted an eye or gave me a judgmental look at all during any of our appointments. She adjusted my medications appropriately and would check in often just to see how I was doing on the changes. Her approach to medicine was the same as mine, where only one is added or changed at a time in order to identify the effects. It's a longer process, but one that I felt was safest and most accurate, and was thrilled that she felt the same way. If there's ever a discussion about medication that could be abused, she would try to address my symptoms with easier to manage options. She made sure that the medication she did prescribe didn't negatively react with each other or any medications that I take periodically. She will also admit if she's unfamiliar with the subject and will often return with useful information after doing some research of her own. All of this may seem like common practice, and I believe that it should be. Unfortunately, my personal and secondhand experiences throughout my life has shown me otherwise. I'm a huge advocate of doing proper research, as well as taking the advice of professionals under consideration. And of course, vice versa. It's never a bad thing to double check each other, which is what Dr. Barnes and I do often. She was never insulted or condescending when I questioned her, and would simply and clearly explain the option she chose and offer me some potential alternatives. When I finally approached her about possibly adding medical cannabis, she informed me that she had been looking into that being a possible option as well. She sent me all I needed to know about obtaining a medical card, as well as recommendations of who to go to, since she herself was unable to do it at the time. All the while she was going through furthering her own knowledge of cannabis and becoming a certified nurse. And here we are. Dr. Barnes has not only been my professional psychiatrist, but she has been my guide and my cheerleader to bettering my mental health, from prescription medications, professional referrals, and medical cannabis. So when she asked me to do this talk, I was absolutely honored to do so in return to support her. And Dr. Barnes, I'm so excited and proud of you for your accomplishments. And I know that you will continue to make an impact for those that come to you for help.
Thank you, thank you, thank you. I reached out to you. I was like, oh my goodness, you know what? I was like, I know a couple people I can ask, but it's good when you have patients that are advocates, again, for themselves, that are wanting to become better. And like she said, she came with her folders. She came with her, I had never had anybody come with a tracker. She came down with, she just came down with some trackers and it was some good information. And again, I learned from my patients as well. So things she taught me, I was able to share with other people. So again, thank you for that. So moving on. Other negative effects that do not help with the stigma are, one of the stigmas, can a person die from using cannabis? And fun fact is, a person cannot die from using cannabis. Actually, a person would have to consume nearly 1,500 pounds of cannabis within 15 minutes to induce a lethal response. That's not going to happen. The negative effects are usually related to what someone would say a bad high, but it's not going to kill you. What is a bad high? A bad high might happen if a patient experiences a high pretty much they weren't expecting. There are two general strands of cannabis that produce different highs. An indica high is more of a body high, precipitating relaxation, pain relief, and appetite stimulant. Sativa strand is more of a head high, being more alert, creative, and experiencing increased energy. Having proper education on which strand produces which high will help to increase the positive benefits of cannabis and eliminate the stigma. All right, so increasing legalization for equality. So in Virginia, some laws recently changed and they're not positive for having cannabis as a medicine. So Virginia NORML is the National Organization for the Reform of Marijuana Laws. And they simply stated it, rather than creating additional ways to criminalize Virginians for personal possession of cannabis, the Virginia General Assembly would rather serve constitutes by establishing a legal adult use marijuana market and ensuring that all cannabis products sold in the Commonwealth are accurately labeled and regulated for consumer safety. So there's a total of 37 states, DC, Guam, Puerto Rico, and the Virgin Islands that regulate cannabis for medical, also medicinal use. With all states not having a cannabis program and it being illegal federally, there continues to be a stigma labeling as something bad. Again, legalization creates safer use. So again, seems like Virginia is going backwards in reference to their medicinal cannabis, just like many things in the world right now. And the Virginia General Assembly voted to approve the budget bill, which contains language to recriminalize personal possession over 4 ounces of marijuana in public. The language, which creates 2 new misdemeanors, will take into effect when the new governor signs the budget. So currently, what that means, currently the personal possession in public of more than 1 ounce and up to 1 pound of marijuana by adults 21 and older is subject to no more than a $25 fine. Upon the governor's signature, personal possession in public of over 4 ounces and less than a pound of cannabis will become a class 3 misdemeanor, making it punishable by a $500 fine. Then second or subsequent offenses will be class 2 misdemeanors, punishable by up to 6 months in jail and or a $1,000 fine. Again, that helps no one. So additional setbacks, the original adult use bill that passed in the Virginia Senate set the date for adult, which is also recreational use in Virginia for 2024. Our former governor recognized that treatment regarding people of color remains inconsistent compared to those that are not of color when enforcing penalties, and he pushed for amendments that would address the issue of social equality. And this is in his quotes of what he said: people of color and those not use marijuana at the same rate. People of color are 3 times more likely to get arrested and convicted. So again, recreational use and adult use. The Virginia Cannabis Control Authority wants to move the adult use to 2023 from 2024. But the way the recent changes in leadership are, who knows when that's really going to happen. Additionally, when adult use arrives, The dispensaries are licensed to sell adult use cannabis. Medical marijuana patients will still have priority over recreational consumers. So we all know that marijuana comes with many things that aren't favorable besides just losing your job because you may have traces of marijuana in your system. Qualifying for medicinal cannabis can bring unfortunate legal and economic consequences that go, again, beyond employment. Your Second Amendment rights are questioned, and this is a question I get asked all the time. Can I have a gun and a cannabis card? So again, one of my things I do, I research. So this comes straight off the Virginia State Police, and what it says, firearms purchase eligibility test. A person who answers yes to any of the below questions may be prohibited from purchasing or possessing a firearm. So when you go to purchase a gun, what will happen, you'll get this form. The form actually has 23 questions. The one that is specific to marijuana is question number 10. And I'll read it and then I'll kind of break it down a little bit. So it says, are you an unlawful user, addicted to marijuana or any depressant, stimulant, or narcotic drug, or any controlled substance? The Federal Gun Control Act defines an addicted person or unlawful user as a person who has a conviction for use or possession of a controlled substance. Within the past year, or persons found through a drug test to use a controlled substance unlawfully, provided that the test was administered within the past year. So again, what this means, are you an unlawful user? So when you go check yes or no, and it says, are you an unlawful user? If you are prescribed, have a certificate for cannabis, then therefore you're not an unlawful user. Are you addicted? Never been told by anyone that they're addicted to marijuana. But again, that's a yes or no. And then there's other medications up here besides marijuana, but everyone gets stuck on the marijuana. A depressant, a stimulant, a narcotic. So again, a stimulant, someone who takes ADHD pills. People take them all day long. They never say, oh, I don't think I can go, register for a gun. Or a narcotic. Again, people who may be prescribed a Schedule II medication, a Percocet for pain. So again, this is a question I get asked all the time, and either you say yes or you say no. So again, cannabis assists with many ailments, again, such as pain, anxiety, insomnia, which is just reason I always go to these because these are the main things that I kind of get from patients. If you experience anxiety or depression, you usually have insomnia, pain, it all kind of comes together. I see so many times when patients are prescribed different medications for multiple ailments, again, such as pain, anxiety, and insomnia. For pain, they may be prescribed a Percocet, which is a controlled substance, Zoloft, which is an antidepressant, Xanax, again, something else that is controlled, and Ambien, again, a controlled medication. At that point, cannabis is something that can assist with all those ailments, where someone would just have to take one medication, which is the cannabis, versus multiple medications to treat all of those ailments. Again, receiving education on what strand, terpene, route of administration, and how they are absorbed as part of the education provided by a cannabis nurse. So options with CBD isolate. So again, this will be my realm that I'll stay at because again, I treat many patients that just can't have THC in their system. So CBD isolate is an effective alternative to THC. Again, I have patients from veterans to shipyard workers, nurses, many occupations that again can't have THC. Educating that CBD isolate can provide benefits such as what THC does, decreasing chronic pain, boosting the immune system, reducing inflammation, regeneration of nervous cells, reducing or preventing anxiety, and help fight cancer cells. CBD isolate is a pure form of CBD, zero THC in it. Again, education between full spectrum, broad spectrum, CBD isolate, Delta 8, which is legal in Virginia, Delta 9, which is the main psychoactive ingredient in THC, are all imperative, as someone may just see CBD and then pop hot on a drug test. You see CBD in all these stores, someone just sees it, they pick it up, don't realize that it may be broad spectrum where it has traces of THC in it. These are all where education comes in. Again, you have to be comfortable with the person you're telling your deep, dark secrets to. The point is to have holistic care, and full transparency has to be there, or the care will be limited. I tell this to my patients all the time because I consult for therapy a lot. And a fun fact is it takes a patient about 3 therapies before they find a good fit. Change is good. How to seek services for Virginia's medical cannabis program. So July 1st, rules change in favor for cannabis in this aspect. So before July 1st, what one would have to do is seek out a provider and get a certification, whatever that process would be. Then they would have to take the form, upload it. Many older people and some young people, everybody doesn't have access to internet. Everybody doesn't have access to a computer. Then they would have to upload the certification along with other documents. And once they did that, then what would happen next is they would be told they would receive their certification in the mail. It was taking months for people to receive their certification. So then they changed it over to, they would send it to you in your email. Again, it was taking about 60 days. So, and not only that, you had to pay a $50 registration fee. So the $50 registration fee is no longer needed. So now all one has to do once they receive their written certification from a registered practitioner is go straight to the dispensary. So for the 757, the dispensary in Portsmouth accepts the hard copy. So you give them the hard copy with a copy of your license with the same address on the form as it is on your license. Or when you get there, you can share it via email. And that's the email that they share with you right there. Once you get that, you're in the system. Some good news that they told me last week is that 2 new dispensaries will be open up. One will be in Williamsburg. I can't remember the street that she told me. And then one in Hampton, which will be on Cunningham Drive. So qualifications. The Virginia board says that any diagnosed condition or disease determined by the practitioner to benefit the patient it qualifies them. So again, we kind of went over patient possession limits, but the specified possession limit for botanical cannabis allows for up to 4 ounces per 30 days to be dispensed to a patient. Also, once you go to the dispensary, what you'll note is that any form of cannabis of the THC is not any more than 10 milligrams. So if you go get a pre-rolled, if you go get edibles, whatever it is that you get is no more than 10 milligrams. No matter how the form is, it kind of goes up and down, but nothing any more than 10 milligrams. Home cultivation. So if you're at home and you want to grow your own plant, you can have 4 plants per household for the adult use, again, 21 years and older. And again, that's per household, not per individual in the house. So again, it is perceived that in 2024, Virginia will move into adult use, also known as recreational use, but we'll just have to wait and see how that happens. So this is, I hope you can see this really well. This is a copy of the certification that when you go to a provider, this is what gets filled out. So here, the patient's full name goes here. Then 1 year from the date of the certification, this is checked. Your address has to match your address of record. So whatever is on your driver's license has to be here. And your driver's license number's here. And below this is information for the provider. So this is a simple form. You go to a provider, whatever their intake process is, this is the form that you will receive that has to be provided to the dispensary. The dispensary won't even, they're going to crack the door. The security guard is going to crack the door, look at you and say, do you have a certification? And then shut the door if you don't have one. So in conclusion, my take is a patient has the right to be educated properly and to take part in their care plan and choose medicinal cannabis as a medication, not a street drug. And if your provider doesn't do it or they won't refer you, find another one. Okay. And these are my references, as you know, that's what we just have to do if we look up stuff. And here is myself, my personal business, Lotus Holistic Health. And now I have to make y'all big again. Okay, Sierra.
Yes.
That's it.
Awesome. So right now, we will open